Welcome to Reid Presents Connect to Develop, where we provide insight from healthcare leaders on the hottest topics and trends. Hello, listeners. I am extremely excited to introduce you to and dig into this interview topic with Stuart Simpson, Chief Executive Officer of Think Surgical and a 30-plus year veteran in the healthcare industry. He has led some of the top companies in the orthopedic space, done some of the most innovative things, and we're just excited to talk about the solutions-based partner concept in today's healthcare setting.
Hi, Marney. I'm excited to be with you today and look forward to the conversation.
So, Stuart, what does innovation mean to you in the world of patient care?
I think there's three elements or three main areas of innovation in patient care. First of all, advances in clinical treatment, where treating conditions which were not previously treatable, or new treatments with less risk, less trauma, and better outcomes for patients. Secondly, I think about advances in treatment protocols, providing a better patient experience across the continuum of care from pre-treatment through intervention and into recovery. And third, I think about advances in access to care, making treatments available to more patients who require them around the world.
Right now in the orthopedic space, what do you feel is the biggest problem that the industry is looking to solve?
That's a great question. The orthopedic industry is dominated by a small number of companies who are pretty risk averse and not able to pursue meaningful advances in clinical treatment. Most of the meaningful technology innovation is happening in smaller private companies who often lack the scale to make their technology more widely accessible. However, the big companies are leading the way in advancing treatment protocols by focusing on building digital and data ecosystems. And, two of them really stand out for me, Marney. Zimmer Biomet with their ZB Edge and Persona IQ technologies, and Smith & Nephew with their RI Insights. But this raises a major challenge faced by the industry, which is access to data and the dispute between the different stakeholders regarding data ownership. Who actually owns the data and should have access to it is one of the biggest controversial topics in the industry right now.
I can understand all sides of that, right? It's the physicians, patients, but the health system are the ones where the treatment happens, but then industry is enabling a lot of this. How do you feel the market, surgeons, and patients view innovation, especially in light of the trends that we're seeing today?
Let me start with surgeons first. Surgeons know that they can always improve the art of surgery, and increasingly they're recognizing the role that enabling technology can play in that journey. Technology is impacting every other aspect of our lives, and healthcare is starting to catch up. But when I think about patients, I believe that patients are looking for a better experience when they consume healthcare and are feeling the benefits of technology and digital transformation in all other aspects of their own lives. So they want a more connected experience and believe that technology such as robotics leads to better outcomes. So I think that there's incentives and motives for both surgeons and patients to embrace more innovation, particularly more connected communication across the continuum of care. Patients particularly, they enjoy the convenience of accessing healthcare in these new formats. And it's not for every intervention or every interaction, but for the ones where that type of interaction makes sense, it's just so much more convenient from a time and cost perspective for the patient.
Can you share with us the most impactful changes and innovative technologies that you personally have seen in the orthopedic space since you started healthcare?
Well, that's a big question, more so because I've been in this industry for such a long time. But there's different types of innovation. I think of innovation that driven by surgeons and supported by industry, such as direct anterior or other muscle-sparing approaches to the hip. It's a great example of a surgical technique innovation in orthopedics, which has had a tremendous benefit on patient experience, especially when they're recovering from hip surgery. And then I think about innovation that's driven by industry and supported by surgeons. And robotics is the most prominent current example of that type of innovation. The first phase of Mako-type robots are too big and complex for the majority of surgeons. But as the technology becomes smaller, easier to use, and less expensive, more surgeons will adopt robotics. And as you know, technology always gets smaller and easier to use as it matures. And then there's other innovation driven by surgeons, which is fueled by insurance and accelerated by the pandemic. And I think about outpatient joint replacement as the best example of innovation in a care pathway that has had a profound impact on patient experience as a consumer of healthcare. They can now access treatment more convenient location and recover at home rather than spending a long time in hospital. So, there's different initiators and supporters of innovation, and hopefully those are three that people identify with.
Have you seen anything make some headway and then just not catch on? And if so, what was it about the product, service, or technology that wasn't successful?
Yeah, as I think about this, there's a few examples again. First of all, hip resurfacing. It's a great concept and probably a better option than total hip replacement for the right patient. It's been through a couple of phases of popularity, but challenges relating to poor patient selection, technique sensitivity, and materials caused it to fall away twice. You know, it may yet enjoy a comeback, but that remains to be seen. The next one is partial knee replacement. It's another great concept, and the evidence suggests that for the right patient and done well, the outcomes may be better than a total knee replacement. But again, poor patient selection and technique sensitivity caused it to fall away. That trend may be reversing now, though, Marney, with the introduction of robotics, which addresses the technique sensitivity challenge specifically for partial knee replacement. And then the third example I can think of over the years is navigation, which was a hot technology in the early 2000s, offering surgeons the opportunity to augment their surgical instruments with positional information, but it failed to make a big impact. My personal opinion is that it only addressed half of the challenge. And today, CT-based robotics help surgeons deliver more precise and accurate, personalized surgery for each of their patients. Navigation didn't so much as fall away. It was more or less it was displaced by a more complete solutions when robotics hit the market. So hopefully some different examples of things that have come and gone and may come again.
Could we stick on the thread of individualized, personalized surgery?
That personalized experience which you're talking about. And I happen to agree that there really is an opportunity there to provide a more personal experience of the whole healthcare episode. When I talk about personalized in this context or the context of robotics, I mean the enabling technology, the robot helps the surgeon to deliver a surgical plan and a surgical precision for the patient that is based on their own individual anatomy and their own individual functionality of their joint, for example, a knee replacement. While hip and knee replacement procedures are very successful surgeries, over the years, the approach and instrumentation has been developed to treat everyone the same way. So the same surgical goals for all patients. And the introduction of three-dimensional preoperative planning with CT has helped surgeons visualize the individual differences between each patient. And the technology itself allows the surgeon to assess the function of a joint during the procedure and adjust the surgical plan to deliver the right target for each individual patient. And I believe that's one of the reasons that robotics, particularly CT-based robotics, is having a beneficial effect on the outcomes of patients, at least in the early recovery stages and potentially longer term.
That makes sense and agree. I would want, intraoperatively things to be adjusting specifically for my anatomy and also to I look at it kind of in an integrative medicine way, right? Treat the patient, not the disease, the various factors that that patient is going to do, with that joint afterwards. What are the three most important market or timing variables that a company needs to consider when launching something new to the market?
I think it's important for a company to think about, is the product truly ready for market? And by that, I mean, you can work through product development and the validation and verification testing that is required to get our regulatory clearance to bring a product to market. But you can go beyond that in terms of robust pre-market testing to truly understand the performance of the technology and the user experience of using that technology. So I think there's a tendency in our industry to test to pass, if you know what I mean, rather than test to fully understand. And I would advise all companies to test to understand exactly what you've got. And then when industry introduces the technology to market, it should be in a controlled manner because there are always going to be things that you don't know and cannot know and can only learn during the early commercial phase of a new product. Once it gets outside the design surgeon's hands and into the broader community, things will be learned which you couldn't learn during the product development. And I cannot advocate strongly enough for introducing new technology in a controlled manner to make sure that those things come up while limiting the exposure of patients. And third, companies need to know and understand how are we going to respond when we run into these things that we're going to learn, because we are going to learn things. And I encourage companies to embrace that learning and be prepared to slow down their commercial efforts in order to refine the product and ensure that it really is robust, doing everything it's supposed to do, and creating a good customer and patient experience before they really add fuel to the commercial effort. And, so I think that's my advice for all companies in this market. Make sure the product is robustly tested, not just to pass the regulatory hurdles. Make sure you introduce technology in a controlled manner and be prepared to make some tough choices when you do learn new things about your product in the early clinical stages. I always say to people that I work with, you only get the opportunity to have a great product launch once. There's no such thing as a great product relaunch. So it's worth taking the time and effort to do it right first time.
Let's go down another path for a minute and talk about the relationships today that companies need to have with health systems and even ambulatory surgery centers versus the relationship, I want to say 10 years ago, but quite frankly, it was more like 20 years ago, I think that they called the golden age, right?
The golden age of our industry, absolutely. In the
The
past,
golden age for industry.
well, for everyone. In the past, this was a transactional relationship, and industry launched new products and increased the prices of each new product to leverage physician preference or brand loyalty to maximize revenue. And it was a rinse and repeat type of cycle in this industry. Today, industry needs to become a trusted partner with the customer by understanding their clinical needs and business challenges. Physician preference and brand loyalty have not gone away, but are quickly changing and increasingly moderated with economic responsibilities to the healthcare facilities, whether they're a partner or an employee. I think there's an increasing awareness amongst the physician community that they have an economic responsibility to balance their clinical preference items as well. So I think we're seeing many of the big orthopedic companies talk about partnering with their customers, particularly in the ASC market. But largely that's just code for bundling more products together in return for discount or financing support. And look, don't get me wrong, that's not a bad start, but it isn't really a partnership model where risk and reward are equally shared. It also suggests that most of the products in the bundle are generic and undifferentiated from the competition, which may be the case. So there's a lot more room, Marney, for true business model innovation where risk and reward are shared equally between the two stakeholders.
And that's the name of the game, to your point, for the ASC space is, sharing in that outcome and the costs if the outcome isn't ideal or anticipated.
Absolutely. And, it's interesting that many of the big companies talk about their ASC strategy, their partnership with customers in the ASC. And at the moment, I'm finding it hard, with the exception of maybe Stryker, to see that as anything more than just a code for bundle selling.
That makes sense. Very different sites of service, different mentalities when approaching them as well, and different levers to pull. That's what I found when went from industry into the ASC setting is, there's a paradigm shift of how industry thinks, which can be very challenging, especially for these health systems that are creating not just HOPDs, but standalone ASCs. So I can understand the challenge both ways.
Yeah, and that is a big financial challenge. There's a big operational challenge getting up and running and getting to scale. And it really is a different customer set of requirements that the industry are trying to respond to. But I think there's a lot more that industry can do there, to be honest.
Way back when I was a surgical device sales rep and I was having discussion with the heads of supply chain and the small health systems in my territory, I felt like myself and my leadership were always asking them questions about how to best partner with them and their providers. Are conversations different today? Are health systems ever sitting down with the heads of medtech like yourself and asking you to propose partnership options and especially in the tech space?
Not really. They're asking for cost reduction proposals and bundle deals, which give them access to new technology in return for disposable volume commitments. But they're not really asking for meaningful partnership proposals. And I think that's largely driven by the economic challenges that they're facing in their own business. Running a hospital today is so much more complex and difficult and challenging financially than it was 10 or 15 years ago. And the same is true of setting up successful either HOPD or ambulatory surgery centers. So a lot of the conversation really is around cost reduction and can you give me more for less? But I do think that there will be an increasing appetite for talking about what partnership means and could mean as we move forward.
Do you think that the market, and by market, I mean the both administrative and physician leaders are ready for that shift in the way that they approach these relationships? They're so ingrained with how they should or will interact with industry. I mean, are we ready?
I think two things need to change for true partnership models to develop in medtech. And I say medtech, but I'm talking about orthopedics. All my experience is in orthopedics, so I can't really speak to the other sectors of medtech. First, the industry needs to make it easier for customers to access new technology at no initial increase in cost, at least for some time while they work collaboratively with the customer to prove the value of a new technology or innovative business model. And second, the customer needs to be willing to partner with industry to prove the value of new technology and innovative business models, and then be willing to share the value generated with their partner. For this to happen, it's going to require new levels of transparency and trust in the relationship. It will require information sharing to establish the baseline and performance metrics, as well as ongoing performance data to calculate the real value. It will require mutual respect to allow both partners to develop a sustainable business from the relationship. There's no such thing as a great partnership if one is prospering, one part of the partnership is prospering at the expense of the other. And I think that's the mind shift change that needs to occur. It's still quite transactional and at times combative, where each is trying to get more of the value than the other. So I think that will change, but it's not an insignificant hurdle to overcome.
I really like that concept of that it needs to be a symbiotic. That's the opposite. What do you think would be the biggest miss in orthopedics and, patient demands, surgeon health system needs if the industry loses the capability for that partnership and it isn't able to implement these new technologies?
Yeah, I think about the business that I'm in, which is robotics, and I think about our business model, which is implant agnostic business model. We're doing that because we think it's better for the customer. It's more, and ultimately, hopefully, better in the patient's best interest. Um, we're trying to provide the customer with maximum choice and flexibility in their robotics program rather than trying to sell them more implants. And the reason I say that is because I do think that one of the biggest misses in the orthopedics industry is to continue to drive business models that leverage one product to get customers to use a whole host of other products that they may not have otherwise chosen. And that's what's happening in the robotics market at the moment. And I don't think it's good for the customer and ultimately may not be in the patient's best interest. So I would encourage the orthopedic industry to think about less trying to leverage more sales and revenue from their customers and more about trying to provide the customer with the solutions and choices that they need in order to be successful in their business and deliver the best patient care. At the moment, then, there is a trade-off between the technology and the implant. And ultimately, the implant's the thing that's going to be in the body for hopefully decades and is going to be used by the patient every single day as they get about their activities of daily living. And in the market at the moment, there's one perceived better robot, but it's associated with an older implant, and there may be more modern, better alternatives. But that the customer has to decide which is more important, accessing the best technology or the best implant, and there's trade-offs there. And in a perfect world, the customer would be able to choose the best technology and the best implant independently. And, that's what Think Surgical is all about and why I came here.
That makes sense. So, as we wrap up this discussion, what is the biggest collaborative partnership suggestion for any health system or physician leader listening to this that you would propose out there? I mean, it's change of mindset, it's a different discussion. So, in an ideal world, what does that meeting look like?
I would encourage them to select a portfolio of partners, which includes one or more of the larger companies, as well as some of the smaller, more innovative companies in the market. Much of the real innovation in orthopedics comes from these smaller companies who are hyper focused on advancing one technique or one technology, rather than the bigger, broad based companies who really are playing it safe. I would also encourage them to be clear about the products and technologies they're using and be honest about the things which are commodities versus the things which are truly differentiated. It's the differentiated technologies and the differentiated business models where the biggest value opportunity lies. And if the customer is clear about the commodities versus the differentiated items, I think it leads to different partnership models and different purchasing behaviors.
That makes sense. And it sounds like that would be a collective of a mixture of administrators, so the non-clinical and the clinicians to have a successful conversation like that.
Absolutely, absolutely. But the first point is an important point. Orthopedics is unlike many other areas of medtech. You've got a small number of companies that are dominant. They have about 85, 90% market share held by four companies. And those companies are playing it safe in the main. And most of the innovation and most of the advances are coming from those smaller, hyper focused companies that I talked about. So if you are negotiating with the big companies and all going exclusive with them, you are going to miss out on a lot of innovation opportunities until those companies end up identifying the innovations that are succeeding and acquiring them. So as a customer, I would want to have a balanced portfolio where I have one or more large companies, but also carve out some of my business for the smaller, more innovative companies because there's true innovation and true value being created by those smaller companies.
I love that, and it makes sense, and anyone out there with any kind of finance background is saying, "Yes, diversify the portfolio."
I probably wouldn't have answered the question that way while I was an executive for one of the large orthopedic
No, I probably not, but, it's good to hear both sides, and it's really exciting to see someone who spent so much time, building within and innovating within one of those huge, the big 4 as we call them, being able to go and take that huge perspective of, the global roles that you play and be able to filter that knowledge and experience into something that moves rapidly and that innovates, on a dime based on customer feedback.
I have to say, I enjoyed my career over more than 2 decades at one of the big 4 companies, and I wouldn't change that for the world. But I also loving the different environment that I'm operating in now as a member of a smaller, more innovative, faster moving private company. There's room in the market for both, and there's need in the market for both. And I'm enjoying the opportunity to have this different experience at this stage of my career, Marnie. And I can't thank you enough for the opportunity to share some of my thoughts with you this morning.
Well, it's always a pleasure to have discussions with you and look forward to the next time we get to sit down at AUKUS or, the Eastern. For listeners, if you want to learn more about Stuart Simpson and Think Surgical, please check out his bio in the show notes. Thanks for listening to Connect to Develop. You can find more interviews and Marnie's Minutes on my YouTube channel at Marney Reid Presents.